Hello everyone, this is Max from Remarkable Physiotherapy and Rehabilitation and welcome back to the channel. In today's video, we are going to discuss about cardiac rehabilitation, which includes some of the common cardiac conditions and some strengthening exercises. Now, cardiac rehabilitation, or commonly known as cardiac rehab, is a customized program for patients who are suffering from cardiovascular conditions, which can be in the form of both exercise and also education. The main objective of cardiac rehab is to improve your health and also help you to recover from a heart attack or other forms of cardio-respiratory diseases or surgeries. The symptoms may consist of shortness of breath, exercise intolerance, and prone to fatigue. Damage to the lung tissues can cause spasms of the respiratory tract, seen in underdeveloped lungs or premature newborns, or damaged by lung diseases such as emphysema, heart failure, and many more. Children with cardiac problems will have a risk of delay in their motor development as well. By involving in exercise training, emotional support, and education about lifestyle changes, this can help to reduce the risk and reoccurrence in cardiorespiratory diseases and improve their quality of life. Below are some of the cardiorespiratory diseases. In asthma patients, their airways are narrowed due to inflammation, causing the surrounding muscles to swell up and tighten, or the airway is filled with mucus that causes difficulty in breathing and triggers cough. Common symptoms including whistling or wheezing sound and shortness of breath. Although not everyone with asthma will have the same symptoms, but symptoms are recurrent and often worsen at night and during exercises. The causes of asthma worsening vary from person to person. This includes exposure to dust, smoke, fumes, changes in the weather, pollen from flowers or grasses, animal furs or feathers, and even perfume. Although it cannot be cured and is a long-term disease of the lungs, but with good management and inhaled medication, we can control asthma and live actively. Pulmonary hypertension is a life-threatening condition which can be worsened over time. It is a type of high blood pressure that affects the arteries in the lungs. The narrow, blocked, or damaged blood vessels in the lungs forces the heart to pump the blood even harder. Symptoms include chest or upper right abdominal pain, fatigue, racing heartbeat, swelling in the ankles and legs, or fainting. When worsened, it can lead to conditions such as congestive heart failure, blood clots in the lungs and liver, lung diseases, and also sleep apnea, which is a type of sleeping disorder. But with treatment, we can help you to control the symptoms and live better along with the disease. Cardiac failure. This occurs when the heart muscle is not able to pump enough blood to meet the body's needs for oxygen and blood. Some conditions such as coronary heart disease and hypertension can gradually leave the heart muscles weakened or stiff to pump blood to all the body's tissues efficiently. Not all conditions can be reversed, but with treatment, patients can help to live longer. Signs and symptoms may include shortness of breath, rapid or irregular heartbeat, lack of appetite, nausea, decrease in alertness and concentration, persistent cough or wheezing with white or pink blood-tinged phlegm. The cardiac rehab consists of 3 phases, which consists of medical evaluation, reassurance and education about coronary artery diseases, correction of cardiac misconceptions, risk factor assessment, mobilization, and most importantly, discharge planning. Patients in this phase are also being exposed to graded exercises such as walking and stairs climbing. This includes baseline patient assessments, nutrition counseling, risk factor management for hypertension, weight control, diabetes, and smoking, psychosocial management, physical activity counseling, and exercise training to develop a better heart strength. Heart strengthening exercises can be in the form of cycling, treadmill walking, arm ergometer, and even hand weights. This phase may last for at least 24 sessions or above, for 3 times per week, and it takes about 1 hour per session. In this phase, we mainly help the patient to continue to maintain a healthier lifestyle through supervising the exercise sessions and health education. Exercise programs are tailored according to the individual's needs. This phase may take up to a period of 3 months. The goal of cardiac rehab is to gain a better long-term maintenance through lifestyle, regain strength, prevent worsening of conditions, as well as to improve in cardio-respiratory and muscular endurance. Below are some of the strengthening exercises that you can perform at your home. Chair squat. This is a very useful exercise as it is a whole body exercise which can strengthen most muscles of the body, especially the core and lower limbs. To perform this exercise, your legs should be shoulder width apart. Hold your hands together and reach your arms forward. Slowly lower your body by squatting down until you almost touch the chair. Make sure that your knees are aligned with your toes so that they do not go outwards or inwards when squatting down. To make it easier, you can start in a sitting position, hold your hands together and reach your arms forward. Lift your body up away from the chair and sit back on it. You can also make it harder by performing this exercise without using the chair at all. Perform this exercise 3 sets with 10 repetitions per set. Incline push-up. This exercise mainly trains your chest and upper limb muscles, which can stretch out your chest muscles and allows you to expand your chest effectively when you breathe. To perform this exercise, your arms should be shoulder width apart. Tighten your core to maintain your body at a straight line. Slowly lower down your body close to the bench by bending your elbows and then return back to your starting position by straightening your elbows. Make sure to maintain your neck at a neutral position. To make it easier, you can perform the push-ups on a wall instead on a bench. You can also make it harder by performing this exercise on the floor with your knees bent. Perform this exercise 3 sets with 10 repetitions per set. Aerobic exercises. You can either walk on a treadmill or cycle for at least 15 minutes with a slow and easy pace. Make sure that you replenish enough water at all times. You can then slowly progress it by adding 5 minutes into your session. Monitor your blood pressure before you exercise and avoid exercising if the reading is higher than 180 upon 110. Cardiac rehabilitation programs have a duration of at least 12 weeks with 2 to 3 sessions per week, 30 to 90 minutes per session. The program should be individualized based on their physical level, and the intensity of the aerobic exercise should be at the heart rate which approximately equivalent to your anaerobic threshold. Exercises will have to include aerobic, resistance, and flexibility training with warm-up and cool-down. Well, I hope you find this video helpful, and that's all for today. If you like this video, please click on the like button, share it, and also subscribe to the channel. Once again, I'm Max from Remarkable Physiotherapy and Rehabilitation, and I'll see you again in our next video. Bye!